Bismillah ar-Rahman ar-Rahim, my dear candidate for MRCS exam. I'm speaking on behalf of MRCS Part B examination courses by examiners and artificial intelligence. Obviously, the advantage of this course, it is done by examiner, which are very experienced, who have seen thousands of candidates who have used to get the grade and see what common mistakes for you to avoid. I'm going to speak today about artificial intelligence. I want you to consider artificial intelligence as your friend and your partner while you are studying for Part B MRCS examination. Number one, not all artificial intelligence tools are suitable for you to do that. I will give you here an example using Copilot. So, for example, if you can go to ChatGPT, which by OpenAI, and you put a question, can you help me in studying communication skills in OSCE examination of MRCS Part B? And the answer, he will tell you for communication skills Part B, you need to understand the communication, you need verbal communication, you need to do active listening. You can see he's giving you the advice, but he is not actually mentioned to you how he can help you in the exam. So this is not extremely helpful. So what I have done is I have trained artificial intelligence, which is Gemini by Google, to be professional in helping me and help a candidate to study MRCS exam. And I used a verbal communication. So if you open from your mobile and let us play the Google Gemini.
Rock.
Good morning, Gemini. Can you help me in studying MRCS Part B examination?
I'd be glad to help you prepare for the MRCS examination. Here are some key areas to focus on and resources that can support your studies. Understanding the exam. Structure. Familiarize yourself with the format of the MRCS exam, including the number of parts, types of questions.
So here he has given you a verbal reply about the structure of MRCS and so on. There is something very simple. For example, I will ask, how long do I need to study for MRCS Part B examination? How long do I need to study for MRCS Part B examination in order to pass safely?
The amount of time you need to study for the MRCS Part B examination depends on several factors, including your current knowledge base, learning style, and the results.
You can see a period of 4 to 6 months is a period that is really optimal for you to plan ahead and to study. I think 6 months studying 5 hours per day should be sufficient. Let us ask, can you prepare a study schedule over 6 months to cover all topics? Can you create a study plan for MRCS Part B examination over the next 6 months to cover all topics?
Creating a 6-month study plan for the MRCS Support to be examination. Note, this is a general study plan. You may need to adjust it based on your individual learning style, knowledge gaps, and the specific requirements of the MRCS Support to be examination. Month 1. Foundation and Assessment. Review the syllabus.
So you can see it's very helpful to put a study plan for you, what topic you need to study, how long it will take, and this is used to take a lot of time from us. Now you can do it very easy and very straightforward. And let me ask another question. Which books do I need to read from? Let us ask Gemini. Which books do you recommend for me to read for MRCS Part B examination?
Recommended book MRCS Support to B. Here are recommended textbooks that can help you prepare for the MRCS support.
Very nice answer. You need to read Belly and Love, Snell, Clinical Anatomy, Davidson, Practice of Medicine. Davidson is quite huge. I would say this is on the outer side. So it has given you a lot of very good suggestions, very good of books. Let me narrow this selection and ask what is the best three books to read? What is the best three books to read for MRCS Part B examination?
The best city books to read for the MRCS Support B examination would be those that focus on core surgical principles, clinical skill innovation. While there are the best books to study from for the MRCS Support B examination are 1. Bailey and Love's Short Practice of Surgery. This classic.
So here he has given you only three books for you to study. So this is a very nice way of knowing which books to read from and even to decide your study plan. So far, we did not use the maximum potential of artificial intelligence. So what we have done is just which books to read, can you make a study schedule, and so on. Let us go to a higher level. We want to get actual training with artificial intelligence in the phone call station, because in phone call station all what you need is just a voice and the reply. So I've put him the question, I am a candidate MRCS Part B and I want a training on phone call communication skills station, and this is the answer.
Absolutely. I can help you practice your phone call communication skills for the MRCS Part B examination. To get started, please let me know. 1. Are there any specific areas of the syllabus you'd like to focus?
So this is a very good start. Let us decide now which station we want to get training at. So I've told artificial intelligence I want to get training on phone call station, the scenario, discharge against medical advice. And let us see the reply.
Let's practice a phone call scenario. Discharge against medical advice, Dharma. Scenario. A patient calls the hospital to...
Here the artificial intelligence already have given you a scenario of a patient in a hospital informing the medical team they intended to leave against medical advice, discharge against medical advice called the DAMA. The patient is concerned about the cost of treatment and feel that he can manage their condition at home. You are the medical team member responsible for handling the call. Key point to be considered. You can see here you need to gather information, you need to explain the risk, and you need to address the patient concern. So let us already have given an advice, but let us make artificial intelligence play the role of an actor. So here I have prompted the artificial intelligence, can you play the role of an actor in this scenario? And I will play the candidate and use your own voice, which means he will not reply by text, he will use your voice. But because I put it in text, he will reply as a text, but this is what I asked from him.
Absolutely. I'll play the role of the patient. Let's get started. Me, as the patient. Hello, I'm calling to let you know.
He already started, and he started by him as the actor, which will be like the patient. And I want to put him the time limit of, let us say, 6 minutes. And then I will tell him, give me an assessment of my performance at the end. So now you will watch me in practice with artificial intelligence in a phone call station, exactly like what happened in the exam. So I will put here, let us make time of the station to be 3 minutes and give me your assessment of my performance at the end, and again use voice. Okay, so this is what is called prompt. So let us see how we're going to perform.
Certainly. Let's keep the phone call to 3 minutes. I'll play the role of the patient, and you'll be the medical team member. Me, as the patient. Hello, I'm calling to let you know that I'm going to leave the hospital. Please respond as you would in a real-life situation. I'll assess your performance at the end of the call. Remember to gather information about the patient's reasons for leaving. Explain the risks and consequences of Dharma.
Okay, let us start the 3 minutes phone call.
Me, as the patient. Hello, I'm calling to let you know that I'm going to leave the hospital.
Dear sir, I am the vascular registrar on call today. Why you want to leave the hospital? Can I know why? Can I know why do you want to leave the hospital, sir?
Me, as a patient, the treatment is too expensive, and I think I can manage at home.
But you know your condition is critical, and we can try to ask the insurance to cover your costs.
Me, as a patient, I'm not sure if my insurance will cover the rest of my stay. I've already been here for a week, and the bills are piling up. I can't afford to stay any longer.
Uh, but you know your condition is quite critical, and I am afraid about your health if you left the hospital.
Patient, I understand that my condition is serious, but I believe I can manage it at home with the right care. I'm willing to follow up with my doctor and take any necessary medications.
So, if you insist to leave the hospital, can you be in direct contact with our consultant just in case?
Me, as the patient, yes, I'm willing to stay in contact with my consultant. Please provide me with their contact information so I can follow up with them as needed.
Okay, I will give you the contact information of the consultant and the phone number, and will give you a report if any emergency happened to you, which I wish not to happen.
Me, as the patient, thank you for that. I'll make sure to contact the consultant if I have any concerns. I appreciate your understanding and assistance.
Is there is any other way we can help you?
As an AI language model, I don't have personal needs or desires.
Can you give me an assessment of my last performance in the last phone call station?
Assess your phone call performance. Based on our role scenario, here's a brief assessment of your performance. Strengths. Empathy. You demonstrated empathy by understanding the patient's concerns about the cost of treatment. Communication. You communicated clearly and effectively, asking relevant questions and providing information. Problem solving. You explored alternative options, such as staying in contact with the consultant. Areas for improvement. Persuasion. While you addressed the patient's concerns, you could have potentially used more persuasive techniques to convince them to stay. For example, you might have highlighted the potential risks of leaving against medical advice in more detail. Time management. While we didn't have a strict time limit for this practice, it's important to be mindful of time during the actual exam. Ensure you can efficiently gather information, address concerns, and provide necessary advice with allotted time. Overall, your performance was strong. You demonstrated good communication skills and empathy. By focusing on persuasion techniques and time management, you can further enhance your phone call communication skills for the MRCS Part B examination. Would you like to?
You can see the artificial intelligence have played the role of an actor in this scenario really very well. And it was in voice conversation. This scenario was created, but I can give him the scenario creation, scenario of the angry patient, the charge against medical advice, any other scenario we think of, and we can get training. And you see the benefit he has given you, what you have performed good and what you have performed bad. So here you have a platform that you can be trained, or any phone call station. The artificial intelligence play the actor and you play the candidate and you get your grades, all done by artificial intelligence. And believe me, you will learn a lot and your communication will become much better. Now let us go to another area where artificial intelligence again can help you. For example, the suture station. In the suture station, someone will say how artificial intelligence can do that. Well, there is a trick. If you videotape your performance of doing suture of a cut wound and you upload your video to artificial intelligence, it can give you a grade. And here I will give you the example. Here I've put the question to artificial intelligence. If I upload a video of me doing suture station MRCS examination, would you be able to give me your assessment of my performance? Notice that artificial intelligence will not give you grades like from 0 to 10 because it's a language model, but it can tell you weak, average, moderate, very good. This far, it can give you assessment. It will understand the way you do suture, where you put your knot, your speed, and your handling. You will be amazed by the answer. So let us put this to Gemini, but this is artificial intelligence. For example, the suture station. I've put the question here. You can see, define if I uploaded a video of me doing suture, can you assess my performance? And you can see the answer. He said, certainly I can help you assess your performance in MRCS suture station based on the video you provide. So you can upload the video and the artificial intelligence will do the analysis and give you your results.
Or by providing a link. 2. Analyze the video. I'll carefully watch the video, paying attention to key aspects such as technical skill, correct knot tying, needle handling, and tissue manipulation, speed and efficiency, ability to complete the procedure within the allotted time, precision and accuracy, minimal tissue damage and accurate placement of sutures, safety.
So here artificial intelligence can assess your suturing skills, same with urinary catheter skills, same with excision biopsy skills. All this, if you put it in 1 minute video, you upload it, you get your assessment. So actually, as I told you, artificial intelligence like your partner. The problem is artificial intelligence have around 40 billion neural network. So this is not the usual answer you will get of Gemini that you use on your mobile or laptop. It is a special Gemini which I have trained on medical knowledge, especially MRCS. And this will be available in our hands-on course in MRCS on 26th and 27th of September. You can have your skills assessed by artificial intelligence. And you can see marking is not done by the examiner, is done by the artificial intelligence. So I am sure this is extremely helpful tool. Now your chances to pass the exam first shot is extremely high. The availability of tools, assistance, and help are there. Please join us either on the free free form over the internet for virtual OSCE station or the hands-on OSCE station. And I wish you all the best.